يتفضل الطالب هلال العتيبي لتقديم البحث الثالث.
السلام عليكم ورحمة الله. Good afternoon, everybody. So, my name is Hallal Badi Alotaibi. As we know, there are tons of drugs that could treat hypertension, but they are different in their efficacy. So, we aim in this study to study the pattern of antihypertensive drugs and the physician's adherence to treatment guidelines. I done the study with the help of my colleague Abdelmajid Fahad under the supervision of Dr. Azhar Rashid, who I would like to thank for this opportunity. So, as we all know, hypertension is called the silent killer. Hypertension is the leading risk factor of cardiovascular disease and death. So, appropriate treatment of the hypertension is necessary to reduce mortality. A prescription-based study is one of the most effective and helpful methods to examine irrational prescribing practice of the physicians. Adherence of treatment guidelines such as 2020 International Society of Hypertension Global Hypertension Practice Guidelines and the Joint National Committee in their 8th session and 2018 Saudi hypertension guidelines are highly recommended to prevent future complications. So, in this research, we evaluate the prescribing pattern of antihypertensive drugs and their adherence to treatment guidelines. So, the method is a retrospective cross-sectional study was conducted on established hypertensive Saudi adults in Dawadmi General Hospital, Riyadh province. The study was carried out of 450 outpatient prescriptions, data collected from physician prescription records, and the 2020 International Society of Hypertension Global Hypertension Practice Guidelines and 2018 Saudi Hypertension Guidelines were used to evaluate the prescription adherence of antihypertensive drugs. The data were analyzed using the statistical software package for social science, aka SPSS, the 25th version. Chi-square test of independent was applied to examine the statistically significant association between two categorical variables. Ethical approval was obtained from Central Institutional Review Board, Ministry of Health, and the Medical Research Ethics Committee in College of Medicine, Dawadmi Shaqra University. So, the results, our study included 429 eligible antihypertensive prescriptions. The average age of the study population was 57.89, around 58, plus or minus 11 years. The majority of hypertensive patients received polytherapy, around 55.3%. Concerning overall utilization pattern, renin-angiotensin system blockers occupied 72.45%, they were the most commonly prescribed class of antihypertensive, followed by dihydropyridine calcium channel blockers, which occupied 66.9%, and diuretics occupied 38.35%, and beta blockers accounts for 17.22%. So, we observed an 86.7% degree of prescriptions adherence, which is satisfactory, and a 68.9% rate of blood pressure control at target blood pressure less than 140/90 millimeter mercury. On the other hand, diabetic patients revealed a 76.4% degree of prescriptions adherence. When we considered a lower cutoff point in diabetic patients, which the target is less than 130/80 millimeter mercury and less than 140/80 millimeter mercury in elderly, unfortunately, the rate of blood pressure control dropped to 45.6%. However, blood pressure control was significantly associated with prescriptions adherence. So we highlighted non-adherence with monotherapy, polytherapy, and elderly patients treatment. Unfortunately, some inappropriate prescriptions have prescribed as a combination of ACE inhibitors and angiotensin receptor blockers, which are non-adherence to the treatment guidelines. The combination of ACE inhibitors, angiotensin receptor blockers, and direct renin inhibitors should not be used because of the greater risk of hyperkalemia, hypotension, and lack of demonstrated benefits in cardiology trials, diabetic nephropathy trials, and with the chronic kidney disease patients. So, in conclusion, the degree of prescriptions adherence and the recommended blood pressure control was satisfactory. The recommended blood pressure goals achievement rate were compatible with international studies, and despite the improved rate of blood pressure control, there is a scope for improvement in terms of rational drug utilization, predominantly in coexisting comorbidities. Thank you all for listening. Any questions?
Thank you, Dr. Hallal, for this valuable presentation, and it's very informative. I will let the floor for my colleague to ask. Yes, Doctor.
Thank you I have comments. If you have any question, you can ask from the students. I think this is the last presentation.
Yes, sure.
Okay, thank you very much.
Thank you.
Students and colleagues, let me share with you one comment. First of all, I thank the research committee and the organizing committee for giving us the opportunity to be here as a moderator. Second point of concern is, as a member of the American College of Clinical Pharmacology and as a member of their education committee, let me share with you one thing, that we finished organizing the materials for 3 to 4 years earlier. So please do not get relaxed. Prepare yourself for the next year research day. Your faculty will always be there to support you. And in good and technologically advanced countries like United States of America, as I shared with you, that being a member of the ACCP, American College of Clinical Pharmacology, we organize material 4-5 years early. So for the year 2025, they have finished everything regarding research, regarding students' allocation for the research and topic. So let me share with you these wordings, that please do not get relaxed. Get yourself prepared for the next year research day, and your faculty will be always along with you to support you. Thank you.